Hi everyone, welcome to Real Medicine with Dr. Canuso. I'm your host, Dr. Dana Canuso, and with me today we have actually one and a half kind of exciting guests. We have Dr. David Zuckerman and Remy. Hi, how are you?
I'm doing very well.
Thanks for being here.
I appreciate the invitation.
Yeah, thank you. So today we have an interesting show. We're going to be talking about something that a lot of people deal with. I dealt with a lot in my practice. It is something that is very hard to treat. Toenail fungus, and everybody knows somebody with toenail fungus. So Dr. Zuckerman has a very innovative new way to treat fungus that we're going to talk about today, right? So can you start, how did you find out about this method, or tell me more about it?
Actually, I'm known as an innovative podiatrist, and the company came looking for me.
Oh, okay.
I brought this to the United States over 2 years ago, and we're getting new developments. Right now, this particular unit we're going to talk about is actually manufactured in the United States by engineers from MIT at Harvard Medical School.
Wow.
Sounds impressive.
It does. I'm
fungus.
impressed.
And the reason why I'm always looking for products that, first of all, are help the patient, but are easy for the patient to use. We know there's lots of treatments for fungus, oral medication, and I used to do surveys. Patients don't want to take pills. Lamisil does have side effects, but patients don't want to take a pill if they can avoid it. And that's why the PathFormer, it forms a path in the nail. That's why it's called
And that's what we're talking about today, the
That's what we're going
PathFormer.
to talk about today.
Okay, and this is new to the United States. This is kind of a new thing.
2 years, it's new.
2 years.
It's been in Europe for over 5 years.
But you said there's some pretty substantial literature out there.
Yes,
Okay.
there actually are what we call evidence-based medicine. There was a three-arm study which compared it to other treatments, and it showed an average of over 70% of the fungus toenail improved within 6 months.
Wow.
Which is really, I mean, as a patient you may not understand that, but as a doctor that is something that is big and new and doesn't require removing the nail. Patients don't want their toenails removed, and that's why I got involved with this, because patients don't want to take pills and they don't want their toenails removed. So it's my job to come up with treatments that are very patient-friendly and very affordable.
Oh, okay. So this is something that, this is not something they would use at home. This is something they're going to go see a doctor for, right?
Yes, it's required by the FDA to be used by a physician or a physician's assistant. Okay, and then not at home.
One of my favorite things that you said out in the green room waiting was that you only need to do it once, correct?
Correct, one time.
So that's kind of novel, because even like a laser or something, they have to come back, and you know. So basically, our options right now are a pill by mouth, which you need liver function test for. A lot of people can't take it if they're on certain medications.
Correct.
There are topicals, which are, you know.
Topicals would work well if they could get to the source of the problem.
Okay.
The infection is in the nail, underneath the nail, and in the root. And that's where this device comes in. It enhances the penetration of the topical. It puts little teeny micro holes in the nail that are painless, and I'll explain to you later why it's painless, so that two things can happen. One is it can hold the topical in the nail, so it's like drip or irrigation, and it can't wash away. It stays there, so you get a higher concentration, and it gets to go through the nail, and that's the biggest problem with topicals. They can't penetrate through the nail. They go around the nail, as you were saying, which they're very poor, very, very poor. And another thing that this machine does is that it puts little teeny holes in it. Fungus doesn't likes moisture. It will dry out the nail because you get air into the area. And two is it allows the alcohol within the antifungal to dry it out.
Very nice.
So you're going to have a quicker reaction, positive effect much sooner.
Okay, so for those of you that aren't doctors out there, we just want to, really important to know about toenail fungus and even fingernail fungus. So fungus lives on your nail bed and in the matrix. And for those of us that aren't doctors, your nail bed is what you see underneath your nail, and the matrix is right behind the nail. So to get to the fungus and to actually kill the fungus, you have to get under the nail plate. And the nail plate is not permeable. There is no way to get through the nail. So what you're saying this does is actually makes little holes in the nail that allow the medication to get to the nail bed and kill the fungus.
What was the name of the Lamisil commercial? The little
the little green monster?
The little monster.
Yeah.
And he always said he gets underneath the nail.
Right.
because it goes through the, your mouth, your bloodstream.
Okay.
This is getting underneath the nail without having to take a pill or remove the nail. You must get down to the infection, and this will do it.
Yeah, this, and for those of you who know me, anything systemic, I kind of, you always want to be careful of. We have to treat our bodies with respect, and I'm not a big fan of pills by mouth for fungus. So I love the concept of this. So, okay, so if you want to start getting into the nitty-gritty of how this works, the patient's how does the patient get this done? How do they get it?
Right now it's very new to the South Jersey, New York metropolitan area. So all they would have to do is one of two things. One is they can contact their podiatrist that they're being treated with. They can, we can bring it over on a rental basis. The podiatrist can actually purchase the device. There are a few devices that are in New Jersey that we can refer to, but if you want to stay with your specific podiatrist, we will bring the device to his office. It's a pretty quick procedure. There's about 20 holes put in the little teeny, you can't even see these holes. They're put into the nail. Each hole is 5 seconds.
Wow. And so that sounds a little scary, putting holes into nails. Is it something that...
Well, I'll tell you something that's interesting about this. And this is a patented technology called electrical impedance. And what does that mean? The nail, which is dead, has no feeling at all. When you get underneath, that's why if you drop something on a nail, you see that big blood blister because the head bleeding underneath the nail. This will automatically stop before, right when it gets through the nail. And how does it do that? It's because the electrical charge in the nail and in the nail bed are two different things. Once it changes the electrical charge, it just stops and retracts. It cannot go into the nail bed at all.
Okay.
It's impossible.
So this is not something that the customer or the client has to have lidocaine on?
No lidocaine.
No pain.
No numbing.
How about after the procedure? Do they have any pain?
It's painless because the nail has no feeling.
Right.
And it's not going into the nail bed. Again, the reason why you have pain when you drop something on it, it's not the nail, it's the nail bed, and it will not penetrate the nail bed. It just puts a little teeny opening, and there's multiple ones. You can barely see it. It would take a magnifying glass to see this. It's the same type of thing, except they use bigger needles when they're doing dermabrasion on your face, on the hair transplant. This is a 0.6 millimeter micro cutter, and the face and hair, it's almost 2. Oh, all right. Almost 2, so it's much bigger.
Well, very interesting. So we're going to take a quick commercial. But when we come back, we're going to actually see this in action. I want to see it get done. So, all right.
We're doing it on you.
No, I'm not kidding.
Actually, to tell you the truth, you could. I had it done on myself.
Wait, we should have planned this. Oh, God. Well, either way, we'll see you. Don't leave. We'll be right back. Hi, welcome back to Real Medicine with Dr. Canuso. I'm here with Dr. Zuckerman and Remy. You can't really see her in the shop, but she's here. And today we're talking about an innovative treatment for toenail fungus. It's something really stubborn to treat. A lot of people suffer with it. And what I love about this treatment is that not only is it innovative, not only is it new to the U.S., but it's backed by really great literature and great medical studies, and it's painless. And it's kind of hard to believe that we were talking earlier, and if you heard Dr. Zuckerman talking about it, it's basically a machine that drills tiny, tiny holes into your nail. And the nail is not a living structure. So when it drives the holes into the nail, you're not actually feeling any pain. It's just like getting a haircut, basically. It's a kind of dead tissue that you're not feeling. So I love this new treatment for toenail fungus. I think it makes sense in theory. I'm excited to see it work. And now we're going to get to see the actual machine. So
the interesting thing is it's easy for patients to understand.
Right.
You know, you're getting down to the infection.
Right.
So what's nice about this is it's very portable.
Okay.
It works on a battery. You just turn this on.
Mm-hmm. Oh, very nice.
And has a light, and it has a little micro cutter in here that's very small, 0.6, which I'll show you millimeters. And you just put it on the nail. You hold the button where you want to go, and it will stop once it senses an electrical change. Like I said, the nail has a certain electrical resistance. And the nail bed. Once it sees that change, like going off of a cliff, it stops immediately and it retracts it. So there's no pain with this at all. It takes approximately 1 to 1.5 minutes to do each nail.
Okay.
And we just put the holes in. It's real simple, very effective. This is what a little, this is the size of it. It's very, very small.
Yeah, I can't
very small.
Can't even see it. So this is something that the physician's going to use on the patient. You said about 1 minute to 1.5 minutes per nail.
Correct.
And there's very little room for error, right? Because
right, it's a computer. Oh, this little thing has, this is what is the brains.
Okay.
This was, again, developed by engineers who are the manufacturers of this device. And you ever heard of Galderma? Mm-hmm. Galderma did the original studies on this.
Oh, okay.
One of the large, it's a French, United States company made Restylane. They did all the studies on this particular device, and that's how they got the FDA clearance for it. Okay. And it's small, but it's the computer in here that is able to sense changes in electrical current, and it's the only it's patent in the world, and it's the only type of patent for this modality.
Wow. Very good.
And it's light.
And it's light, and the doctor can run around. So the other thing that if you're just joining us, if you have a foot doctor that doesn't have the technology, they can easily call the company,
correct,
rent it for you specifically, and the doctor just has to pay a one-time rental fee and correct, give you a treatment. Correct. So you don't have to look for a facility that has the machine. Yeah.
There is one thing that we also add. Even though it's a one-time treatment, mm-hmm, it is an infection, it's difficult. We will automatically, at 4 to 6 months, if we see that it's not progressing, we want, and you can tell your doctor this, there's no additional charge to come back and do it again.
Oh, okay. So it's like a money-back guarantee based, well,
it's based on we're going to try our best to get rid of a tough problem. It's not, well, I'm sorry, we only did one treatment.
Yeah.
And studies have also shown, they're all with one treatment, but we have found in the last couple of years, if it doesn't, and one of the reasons why it may not work is that you may need more holes to get a higher concentration. So we do it again.
Okay, so that's interesting. We didn't talk about the medication. So this is something that now that we have the holes in the nail, the goal is now to treat the fungus and kill the fungus on the nail bed. So what is the patient going to do? Do they do something at home then every day, or how does that work?
Well, that's where you're the expert.
Oh, that's true.
As we were talking in the waiting room, Dr. Canuso products would be very effective with this.
Okay.
And that's one of the things that we're always trying to develop and make better. The product is only as good as getting the product to the area.
Exactly.
And if you have good products and good hygiene, like your products, mm-hmm, you're going to get a better outcome.
Yeah, so people that use my products currently, I have a topical product for toenail fungus, and it's very effective. But the biggest problem is getting it to the fungus. So I tell my patients, put it around the nail and under the nail. Right. And a lot of fungal nails are lifting. So the hope is that some of the medication drips down under the nail and delivers.
That's an interesting thing with this. When you put the holes in it, they're called dermatocytes. That's the openings underneath the nail. You'll get a collapsing of it. Remember that we're not removing the nail, we're not trimming it, we're not debriding. The nail will start to flatten out very quickly, because what will happen is once you get all the moisture out of it, it flattens.
Okay, so this is effective on multiple levels. Yes. And I really, I tell people all the time, fungus likes dark, wet places, and the more we can dry it out, the better. So this is not only allowing the medication to penetrate, but it's drying out the area. I think this is a great option.
Shoes and skin you have to treat also.
So how about someone who's failed laser therapy? Is this something you'd recommend?
Yes. We've had failed lasers. We've had failed, there's a product very expensive called Gibula, which we've retreated. Sometimes you need, like I said, the Gibula could work. You can use any alcohol-based topical. That's very important. All the studies were done, believe it or not, on Lamisil spray, which you can buy in Walmart or CVS.
Oh, okay.
So you can just spray it on over the counter. But we want to improve it. We're getting the products. We now know how to get down to the source. Now we want to get products that are the top of the line.
Right.
And that's what we're looking to do right now. We have a few. I think looking at your products, I think they would be, it's just a match.
Yep, perfect. Well, we're going to take one more break, and when we come back, we'll talk more about toenail fungus. Come back, it's exciting.
I love that.
Hi, welcome back to Real Medicine with Dr. Canuso. If you're just tuning in, we're here with Dr. Zuckerman and Remy, and we're here talking about toenail fungus. And I know 30 minutes of toenail fungus, but this is a very serious topic for a lot of people. It's embarrassing. It's something that people have tried multiple ways of getting rid of their toenail fungus, and this is one of the newest, most innovative treatments for fungus in the United States. Correct. So I'm happy to have you here and talk about it. And so we basically talked about how it works. A patient can get the treatment by having their doctor contact the company and renting the machine, or the doctor can even buy the machine. And actually, if anyone's watching that wants to purchase a machine, this is something that dermatologists can use,
Even your general practitioner, if he's interested, because it's not that hard. It's fully automated.
Okay.
We do provide training.
Okay.
Online training. It's actually CME approved on how to use it, which is, it's really easy. It's just basically put it on there, press it. The computer does all the work.
Oh, well, that's nice.
You know?
Yeah.
It's sort of like cruise control.
Perfect.
The key is knowing if it's a fungus. You know, I recommend taking cultures on this and looking at all the surrounding factors: shoes, skin. The nail is infected for a reason, and you need to find out the reason.
Yeah, it's funny you brought up cultures too, because I always tell people cultures are never a definite. Because I've had many people come to me and said, "Oh, I've been tested for toenail fungus and I don't have it." And then it ends up being toenail fungus. There's a margin of error with the test. There's a margin of error with the doctor. So for those of you out there that are pretty confident that you have toenail fungus and you've not been treated for it, or you think you need to be treated for it, and you've been told that you don't, you may still have fungus. So
you can also, once you have holes in the area, you can add different things.
Oh, okay.
You can put an antibiotic in the area. It's also good for treating psoriatic nails too.
Interesting.
Yes.
So do you like a steroid in there?
Steroid would be put in there. If there's a hematoma, you know how they take the paper clip and put it under fire, under alcohol, they light it and they put it in there, which hurts. This will release the hematoma.
Interesting.
Yeah. Without hurting you, because it doesn't go into the nail bed. Just puts the hole in the area.
So a general practitioner that does purchase this and use this in their office, there's a multitude of uses. And it's FDA registered, you said, for toenails and fingernails, right?
And yes, and hematomas.
Okay, so your construction worker that dropped something on his fingernail that has this really painful new bruise, you just one little hole in all the...
And it'll go.
Comes out. That's exciting.
Without hurting. And the pressure on this, it's very light. You just hold it there. You don't push it down.
Right.
You just press the button, and it will sense when the hole is completed.
Well, that's exciting.
And just retracts. And next, all the bits. This is a sterilized treatment. All the bits are sterilized per patient, so there's no cross-contamination. All the instrumentation with this is sterilized. It's a pretty. I'm very excited about this because, again, I'm looking for a easy procedure for the patient and the doctor.
Right.
And this seems to fit the mold without the doctor having to remove the nail. A lot of people get their toenails removed.
Yes.
A lot of people take oral medications. One of the things I found out with oral medications is, they work well. However, fungus can be reinfected a lot. So after you get it cleared up with the micro drill, you can put little holes in there so that every day they can put medicine on there and keep treating it and help preventing it.
Right.
Like you get your teeth cleaned.
Right.
You know, you should get your toenails treated.
Yeah.
At least.
Well, I'm a big fan. I mean, even with my products, it's you have to stop it before it gets to be a huge problem. So this is something.
This could be prevented too.
Yes, it's pretty.
See it.
Right. And if you know that you are prone to fungus, or if you've had toenail fungus in the past, you don't want it coming back. You know, I have a lot of patients of mine that continue to use the toenail fungus topical that I have, even after it's gone, to prevent it from coming back. And, you know, tolnaphtate and these antifungal topicals are FDA monographed to prevent fungus. So it is something that you can do. So that's a great idea. And I love, too, that you'll come back and do it again if it's not as effective as the patient wants.
Sometimes it may need more holes. It's not getting the proper penetration.
Right.
You know, it's and it has been very effective if you do need a second treatment. Another thing, it doesn't matter how thick the nail is. You can have a real thick nail, your grandmother's nail, and it will work. Or it can be real thin.
And it'll work.
And it'll work.
Okay.
Because it senses when it passes from the nail to the nail bed.
Right. That's an interesting thought, too, because even if it's not fungus, I know that my topical antifungal, it has essential oils in it that actually treat unhealthy nails. So even if the nail is unhealthy or brittle, this might even help penetrate.
You're right. I never thought of it. That's a new
It's the Mensa in me. Oh my gosh. Well, if you don't mind, I want you to tell everyone how they can get in touch with you or how their doctors can get in touch with you to try the product.
Sure. Again, my name is Dr. Zuckerman. I'm from the South Jersey area, but we do service actually across the entire country.
Okay.
Our mobile is in New York, New Jersey, Pennsylvania, Maryland, and Delaware at this point. You can go to our website, which is, it's a long word, FootDocPreneur, FootDocPrenner,
Okay.
.com, or you can just basically, go on Facebook. You can go on your Facebook page. I have a Facebook page, David Zuckerman, and I'll give you my number if you want to call me. You can text me, 856-229-2939. I have no problem calling you back. Even when I was in full-time practice, I always used the cell phone.
Awesome.
No answering service.
Well, that's great. And I mean, everybody has my cell phone. I love that one-on-one connection with patients. And like Dr. Zuckerman said, you can go onto my Facebook at Dr. Canuso, and I'll have a link to FootDocPreneur and the product, so if your doctors want to get in touch with him. And you can also find me on www.drcanuso.com. Again, thanks for watching. I look forward to seeing you next Tuesday at 12:30 again on RVN TV. Have a great day.
Thank you.